Have you ever felt unsure or confused about anatomy down there? Whether you're engaging in intimacy with someone who has a vulva or you have one yourself, understanding how everything works can make a big difference. I'm Dr. Hana Kim, a men's sexual health urologist and pelvic surgeon, and today we're going to cover everything you should know about female anatomy. Be sure to stay until the end, because we'll also discuss the well-known G-spot and what you actually need to understand about it. If you're new here, I'm a board-certified urologist who creates educational content focused on sexual health, bladder health, and many other urologic topics. Don't forget to subscribe and share this video with your friends. Before diving into the details of anatomy, it's important to understand how genital development happens. For simplicity in this video, I'll refer to individuals with a penis as male and individuals with a vulva as female. During early fetal development in the uterus, specifically within the first 8 weeks of pregnancy, external genitals have not yet formed. At this stage, the fetus has two structures that will later develop into either male or female anatomy: the genital tubercle and the urogenital sinus dot. Around the 10th week of development, external genitalia begin forming based on the baby's genetic makeup. Fetuses with 20 chromosomes typically develop female anatomy, while those with XY chromosomes develop male anatomy. The genital tubercle eventually becomes the head of the penis in males and the head of the clitoris in females, because both structures originate from the same early embryological tissues, the genital tubercle and urogenital sinus. They are considered homologous structures. This means they share similar origins, locations, and functions. For example, the glans penis and the clitoris develop from identical tissue, just as the clitoral hood corresponds to the penile foreskin. When looking at other structures, the labia, the inner and outer lips surrounding the vaginal opening, are developmentally similar to the scrotum in males. The outer lips, known as the labia majora, are analogous to the scrotal tissue. Altogether, the external structures shown here are referred to as the vulva dot. At the very top of the vulva sits the clitoris, which, as mentioned earlier, is analogous to the head of the penis. It contains a high concentration of nerve endings, which is why clitoral stimulation commonly leads to orgasm in women, much like penile stimulation does in men. The clitoris also has a protective covering called the prepuce or clitoral hood, which can move back and forth similarly to penile foreskin. Interestingly, in some individuals, the clitoral hood may develop adhesions or become partially stuck to the clitoris, which can occasionally cause discomfort or pain. Before moving on to other anatomical structures, let's take a deeper look at the clitoris itself. The word clitoris comes from the Greek word clitoris or kleis, meaning key, symbolizing the key that opens a door. Embryologically, the clitoris is directly equivalent to the penis, including both the glans and the shaft. Although only a small portion of the clitoris is externally visible, much more of its structure exists beneath the surface. When you examine the clitoris in its entirety, including the internal structures, you'll notice that it is much larger than what is visible externally. As shown in anatomical images, the clitoris extends inward and branches into two sections, very similar to the erectile tissue found in the penis. In fact, anatomical dissection studies have demonstrated that the nerves and blood vessels of the clitoris closely mirror those of the penis dot, like the penis. The clitoris also becomes engorged with blood during arousal, undergoing tumescence in a way comparable to a male erection. I discuss this process in more detail in my videos about sildenafil and tadalafil. If you'd like to better understand what occurs physiologically during erection, you can also see that this erectile tissue surrounds the urethral opening and the vaginal opening while extending outward along the sides beneath portions of the labia minora or inner lips. Because of this, Many individuals find these surrounding areas especially sensitive to touch. Just below the clitoris lies the urethral opening, which is the exit point of the urinary tract, the tube that carries urine from the bladder out of the body. Beneath that is the vaginal opening. The vagina itself is a remarkable structure because of its ability to adapt and change shape. For example, during childbirth, it expands significantly to allow a baby to pass through. Similarly, during arousal, the vagina lengthens and widens, sometimes extending up to 3 inches longer as the body prepares for intimacy. Finally, below these structures is the anal opening. In female anatomy, we often describe 3 distinct openings: the urethra at the top, followed by the vagina, and then the anus dot as mentioned earlier. The clitoris is anatomically analogous to the penis, which is why many women require clitoral stimulation in order to achieve orgasm. Now let's talk about the commonly discussed G-spot. What exactly is it? The G-spot was first described in 1940 by Ernst Grafenberg. It is believed to be located along the anterior wall, the front wall of the vagina, approximately 1 to 2 inches inside. Many people describe locating this region using a come hither finger motion. However, it's important to understand that the G-spot is not a magical button that can simply be pressed. Rather, it is an area rich in nerve endings. Directly above this region lies the Skene's gland, which is homologous to the male prostate. Similar to how prostate stimulation can feel pleasurable for some men, stimulation of this area may also feel pleasurable for some women. Is the G-spot the ultimate key to orgasm? For certain women, penetration that stimulates this region may lead to orgasm. However, for most women, clitoral stimulation remains essential for orgasm because, as explained throughout this video, the clitoris shares the same sensitive tissue, structure, and nerve density as the penis. I hope you enjoyed this introductory overview of female anatomy. In my next video on female sexual health, we'll be discussing female ejaculation, so be sure to subscribe so you don't miss it. And, as always, remember to take care of yourself because you're worth it.